The central part of healthcare reform that draws the most controversy is the question of coverage. If we go from the current system to a system where everyone in the country has coverage, essentially all citizens or everyone who is legally here has coverage, then how do we accomplish that? How do we ensure that the folks that have coverage that they want to keep today are able to do that, but also that there's an opportunity available for folks that don't have coverage today to get coverage at an affordable price? That's the big challenge. Well, there's a substantial amount of waste in our system. I think everyone recognizes that we have an overutilization of healthcare services in our country, and there's a very great disparity between the level of utilization of healthcare services in some parts of the country versus in other parts of the country. And as it turns out, those areas that have less utilization often wind up doing better in terms of health outcomes. So we have to find a way to reduce the overutilization. That's one of the main thrusts of this reform effort. At the current time, since you have nearly 50 million people in the country who do not have health care coverage, many of them depend upon emergency rooms for services. They are not paying any real premium, and accordingly the costs of premiums for those who do have health care insurance reflect that increased cost that hospitals or providers have to take on. So if we could more broadly spread the coverage so that everybody has coverage and everybody is contributing to cover cost, we think that the cost for many people in our country would go down. Well, a major part of the healthcare reform effort is going to be what we call insurance market reforms. I think we have a lot of effort going on in the insurance industry today, the health insurance industry, to try to ensure that if they issue a policy, they don't cover anything that might actually go wrong. And so we need to be sure that that policies that are issued cover a basic set of benefits so that everyone can be confident that they have coverage for those problems, and also that policies issued today are going to be available for the general public. It's not a cherry-picking situation where the companies are looking for healthy people so that they can issue them policies and avoiding anyone who might become sick. That's one of the main reforms we're going to try to accomplish in this insurance market reform. Well, the idea of a public plan option is to have a nonprofit organization that would provide coverage to people who wanted to buy it and would not have all of the administrative overhead that the private insurance companies have. They would have some administrative overhead, obviously. We would set it up so that they would have to stand on their own in the sense that they would have to raise enough in premiums to pay for the services that they were providing to people who had policies through their plan. But we think this would help to keep costs from rising so rapidly in healthcare insurance generally. This effort at healthcare reform is ongoing and will continue into July, but we hope you'll continue to pay attention, and we hope you find it interesting.